Over 10 million Americans had chronic bronchitis in 2011. 70% of those were over the age of 45. Women have chronic bronchitis at double the rate of men. The risk of developing chronic bronchitis increases with age. In 2011, approximately 4.7 million Americans had emphysema. 90% of those people were over the age of 45. The rate of emphysema has increased in women and decreased in men. Worldwide, 64 million people had COPD in 2004, the U.S. contributing 12.7 to 24 million of those people.
Low income and education attainment have been related to a greater longitudinal risk of acute COPD. Individuals who are unemployed, retired, or unable to work are at a higher risk of developing COPD. COPD is very costly and results in a high rate of hospitalization for people over 65 years of age. In 2010, COPD cost the United States $49.9 billion. A majority of this, $29.5 billion, was spent on direct healthcare cost. $12.4 billion was used for indirect mortality cost, and the remaining $8 billion for indirect morbidity cost.
Cigarette smoking and tobacco use is the #1 preventable cause of death in the U.S., yet more than 45 million Americans still smoke cigarettes. Also, approximately 88 million non-smoking Americans, including 54% of children ages 3 to 11, are exposed to secondhand smoke, which is just as damaging as firsthand smoke. What many don't know is that smoking harms nearly every organ in the body in some way. Because it reaches almost every part of the body, it causes a wide array of diseases. One disease in particular is COPD. Smoking accounts for as many as 8 out of 10 COPD-related deaths per year. Female smokers can be up to 40 times more likely to develop COPD than women who do not smoke. Each day, more than 3,200 people, ages 18 years and younger, smoke their first cigarette. These children do not realize that smoking slows down lung growth, and lungs do not reach full growth until the late 20s. Because of this, tobacco products should not be available on campus.
Helping to tackle tobacco use in college students will help reduce cases of COPD long-term. In the JMU community, students are working to eliminate the easy accessibility to the drugs on campus. Mr. Chips, the local convenience store on Carrier Drive, sells an assortment of cigarettes and chewing tobacco daily. This makes it uncomplicated for freshmen and those living on campus to sustain the habit. Eliminating access to tobacco products on campus would promote a healthier environment for all James Madison students.
The Surgeon General has assessed the economic impact of smoking on the American people and assessed that if the American workplace were to eliminate smoking altogether, 1.3 million smokers would stop smoking cigarettes, 950 million fewer cigarette packs would be smoked, 1,540 heart attacks and 360 strokes would be averted, and $49 million in direct medical cost savings would be realized within 1 year.
Many local and state governments are presenting initiatives to limit tobacco use, alongside policies that have already been set in place to ban tobacco from public restaurants. The Smoke-Free Parks initiative, originating in Arlington, Virginia, supports refraining from smoking within 50 feet of ball fields, pavilions, and playgrounds near the county parks. Parks are healthy places for youth, families, and communities. The absence of tobacco products in the view of youth and children prevents smoking from being associated as a social norm, and they will be less likely to be tempted by it later in life.
If an individual quits smoking between the ages of 35 and 39, it is expected to add 4 years onto their lives. If an individual stops smoking between the ages of 65 and 69, it is expected to add 1 year onto their life. Within 20 minutes of the last cigarette, the person's body begins to repair itself, releasing the carbon monoxide provided by cigarette smoking and replacing it with oxygen. Within a week of not smoking, the body will get rid of all harmful toxins such as nicotine, and the individuals will have noticeably more energy. Lastly, within 24 hours of quitting, the risk of dying from lung cancer, heart disease, and all other smoking-related illnesses begin to drop and over time will be equivalent to a non-smoker.